Hello and welcome. This is Dr. George Gonzalez, and this is the Hologram Podcast. And today I have a special guest. She's the Quantum Neurology Doctor of the Year, Dr. Jen Hartley. Thank you so much for being here, Jen.
Thank you for the invitation, George. I'm always thrilled to be with you.
Absolutely. And it was so exciting to have you at this homecoming this year. And you've been so special to our community, and you've helped so many doctors learn about quantum neurology and get into quantum neurology. I have some pictures here I'm going to show real quick. Here you are receiving the Homecoming Award on that top picture. Do you see that?
Yes, I do.
Okay, excellent. And then, getting the big hug from myself. And the big difference is my beard now. I shaved the beard off. But it was such a great honor to have you be the Doctor of the Year. Thank you so much. And it's an amazing things that you've brought to our community, people and doctors that have become advanced practitioners to our community, as well as the knowledge that you've brought forth with working quantum neurology and the concept of miasms, as well as the other things you've presented in the past. And quantum neurology has had a profound effect on your life as well. So why don't we talk about, what's quantum neurology to you and why is it so important to you?
Yeah, well, I do appreciate the appreciation for bringing doctors into quantum neurology. It is something that's always on the top of my mind. I literally cannot talk to a chiropractor without saying, have you taken a quantum neurology seminar? But it is because it has completely transformed my life and transformed my practice. Like, I think all the time, at least 20 times a day, I'll have a patient come into the office and I'll think, I would literally have no idea what to do with this person if I didn't have quantum neurology. And I do admit that when you get the advanced skills of quantum neurology and you start working with the nervous system at the deepest level, or a deeper level, I should say, which I believe is the level that chiropractic was originally intended to work with the nervous system. We just had to advance it beyond what BJ and DD did because our world advanced around us. But I believe that that's what we're doing through quantum neurology, is we're actually working with the nervous system at that highest level. But for so many years, at least practitioners that are within my age frame, we were really reduced to a very strong musculoskeletal box. So even though we had this idea or this knowledge of the power of chiropractic and the power of what could happen if you work with the nervous system, at least for me in school, I wasn't taught how. And so when I started working with quantum neurology and I started recognizing how much more potential we have at facilitating healing, especially facilitating healing with people in this adverse environment, I cannot overemphasize that enough. Somebody once told me in school that the reason that chiropractors back in the day would get these miraculous results, like we adjust Harvey Lillard and all of a sudden his hearing comes back, which is a one adjustment and a miraculous result. And why are we not getting that many results these days, like that many miraculous results? And it's because our nervous systems are so much more compromised than they ever were before. So now we need more refined input or more direct input. And that's what quantum neurology has provided for me, is the ability to do that not only with my patients, but obviously with the people that I love the most, which is my family members and myself. And I could literally talk for probably a day and a half on this podcast about the miracles I've seen, even just within my family alone.
I completely agree, and thank you so much for sharing all those things. I don't have to go much further than my family to realize how everything we've gone through for quantum neurology has been worth it. And just as you saw on the podcast yesterday on facial pain, trigeminal neuralgia, we talked about Lori's injury. My wife had an injury, and the beauty of it, when your family member is injured, and the beauty of it is, as I'm working on her, as we're restoring the muscular reflexes that were damaged and the tissue that was damaged, we were so grateful that we already had the knowledge. We didn't have to go,
we're making it up.
Oh crap, my wife got injured, now what? Which is normally the situation. And we have this knowledge that we have available to us, this technology, this availability to strengthen and restore the nervous system through this concept. So how has this concept changed your perspective of neurology and how to treat patients? Because you are already an advanced practitioner coming to quantum neurology. So what made it different for you?
Yeah, so I mean, that's a really good question. One of the things that has always made me unique within the field of chiropractic, and I'm certainly not the only doctor in the world that does this, is the integration of techniques. So just like I recognize that there is no standalone panacea profession, like all you need is a chiropractor, or all you need is a physical therapist, or all you need is this one person, even within the field of chiropractic, there is no panacea treatment. All I have to do is adjust C1 and everything is going to be fixed from that, which doesn't take away the power of a very effectively and appropriately timed C1 or C2 adjustment. But we've got this whole body that we've got, and we've got all of this input coming in. So we're living in a world where there is nutritional depletion. So if I'm not doing something to address that, even if it's as small as recommending a multivitamin, then I'm going to be missing a component, because I see the body as a garden, and all of these different aspects of the garden have to be fulfilled. So you have to have a good soil in order for things to grow, right? That's the nutritional component. But you also have to have a really good plant, like a nice organic plant, in order to get a good plant. So I see that as working within the system. Like you have to make the system completely whole and within integrity in all of the different aspects. Then you also need water, and you also need light, and you also need wind and air and rain. And if you take any of those aspects away, you're not going to get as good of a garden. So when I'm working with people chiropractically, I've always looked at how can we weave all of these knowledge bases together, instead of sending somebody away for nutrition and then somebody away to get adjusted and then going over to my massage therapist to get their muscles worked on. So my perspective is my original technique was network spinal analysis, which is a mechanical cord, like adverse mechanical cord tension release technique. And then from that, I was putting in the structure, and that's the traditional chiropractic. And then I started working within the field of nutrition, and I started adding nutrition to the complex, and we were starting to get better results with that. But with adverse mechanical cord tension, what I was finding is that does a really good job with a certain aspect of bringing the nervous system into parasympathetic. But what happens if there's a nerve damage all the way down to the tip of the finger or to a specific organ? I can't really just work on adverse mechanical cord tension in order to get that specific thing to wake up. And I also started recognizing that there were certain patients that were coming into my office that you just knew that all of their problems really were stemming in the head. So that's when I found NET, neuro-emotional technique, and integrated that in, but it still wasn't helping with those very specific, obvious nerve issues, or those very specific areas where it's like, I've adjusted this person, I've thrown nutrition at the person, we've handled their emotional stuff. Why are they not getting better? And then when I found quantum neurology and we started working with recognizing that the nervous system actually works as this amazing, holistic, integrated unit, that completely made sense to me. Because again, you can put the nutrition into the body, but if the nervous system isn't completely communicating, it doesn't know where to put it. It doesn't know how to integrate it. I can structurally adjust like the best of them, but frequently that patient would get up off the table, and by the time they're in their car, that adjustment falls right back out of place. So there's something not holding it. So what I love about quantum neurology is it is a very holistic, completely systemic technique where we're recognizing that all of these things are affecting us, and we have a very specific and detailed way of figuring out, well, what is the priority and which one do we have to start with in order to bring that whole unit back into balance.
Absolutely. And I love how you described it as a garden, because, you know, our nervous system, it blossoms into its function, you know, from childhood onward. We're developing these functions, we're blossoming our talents. And it's something that, you know, just as a plant or a tree, it could get damaged. And if that damage does not get recovered, that damage is lost, possibly for that person's life. Yeah. So we have these techniques and strategies for rehabilitation. And could you describe the interaction with the patient, not necessarily step-by-step, but what does that look like, a patient visit for you and the interactions that you're dealing with? You're not injecting them with anything. You're doing physical, hands-on therapy with them, correct?
Absolutely, yeah. So, well, one of the things that I love about quantum neurology is it did completely change my conversation with the patient. So rather than the patient coming in and me saying, well, where's your pain? And then let me try to touch it in whatever technique I want to touch it with to see if that pain can go away. We start talking about, well, what could possibly be affecting your nervous system? So it really opens up the conversation for a whole brain-based and wellness model type practice. Even my intro form had to change. So we start talking about, well, where are your stresses coming from? And how long have they been there? And what else is going on in your life that could possibly be compromising the system? Or what are the things that are positive that you're doing that are potentially going to help our role? So I communicate with the patient largely based off a concept of the nervous system. So because you asked that question, I'm going to step away and show you guys something.
As you have your spinal cord,
yeah,
and nerves and autonomic nerves in the back. It's perfect.
These things are amazing, right? Because you can turn them on and show.
I love them.
Talking about a problem here, but it's affecting the nerves all the way down the tips of the fingers.
Absolutely. Great educational tool.
And
absolutely.
when I start talking to somebody about what we're going to be working with, I actually just show them a picture of the nervous system.
Okay.
So I'm a chiropractor. Is what I always say. I'm a chiropractor, and that gives me the license to work on the human body. But most people are very aware of how chiropractic works with the system in this structural way. But if I just work with your structure, I'm not going to be getting to the entire frame because you're not a Halloween skeleton hanging from a tree. Your frame is animated, and it's animated by this entire nervous system. So what we need to find out to figure out, number one, where your problems are coming from, but more importantly, how to enhance your life so that it's not just about your problem going away, but your entire quality of life starts changing. So we need to figure out where in this nervous system your potential is compromised. And everything that I'm doing is from that perspective.
I love it. I absolutely love the way you present that and bring that to, a visual presentation for somebody to get. And what would you say is the most important thing for the patient the patient population you're working with? What are the most common issues that you're dealing with that are benefiting with quantum neurology?
I'm going to answer that question, but I'm going to answer another question first.
Okay, sure.
One of the things that really happens, I have tons of people that have come to me that have been seeing chiropractors for years, right? Or have been seeing physical therapists for years. And then when we start having this conversation, I would say at least every third time I have to stop and let them emotionally process because they start crying. Because most people will see this and go, oh my God, that's what I've been looking for. That's what I've been telling them. That's what I've been saying. Or that's at least what I've been like kinesthetically feeling in my system, but I didn't have the words for. And then somebody finally puts it into words and they go, that's it. So that's huge as far as practice management goes, right? If you can already have a patient start understanding before you even touch them that you're working at such a deeper level, that's a very big difference. So that's the power of communicating neurologically, is it's not just about, look how smart I am, I'm a big fancy doctor that knows about the nervous system. It's about the nervous system literally is your entire health and wellness. And when they get that, or oftentimes they've already gotten that and they're so frustrated because nobody else is communicating with them on that level. And so you asked me the question about my overall patient database.
Yes, just like on the patients that you're seeing, what things are you seeing that are benefiting with quantum neurology care?
With quantum neurology. Well, I have a relatively unique practice because of quantum neurology. And I think most quantum neurology doctors will find that. So I hesitate sometimes to tell a new chiropractor who I'm trying to get into quantum neurology about some of the stuff that I'm working for, because they're like, that's outside of our profession, or I wouldn't even know how to begin with that, or I don't even know how to work with that. But of course, if you start vibrating on this higher field, who are you going to be attracting to you, but people that need that help and need that work on the higher field. But at the same time, my goal is a wellness-based practice. So my goal is that every single patient walks in my door feeling fantastic, and I can do a fun little visit on them to keep them feeling fantastic. And we do that once a week for them for the rest of their lives, right? That's the goal. And I get 80% of my patients there to that goal in a relatively short period of time. But a large component of my patients are patients that are walking in that have done exactly what I said before. They've been to chiropractors, they've been to physical therapists, they've been to massage therapists, they've had surgeries, they've had cortisone shots, they've had everything that they could possibly think of as a treatment protocol under the sun, and they're still in pain or they're still not getting better. So I attract to me a lot of neurologically based issues, so brain-based issues. So I have a lot of multiple sclerosis patients, Parkinson's patients. I work with a lot of patients that do have some levels of plegias or neuropathies, lots of PTSD and post-concussive or TBI, traumatic brain injury. Those are the most rewarding people to work with, because nothing that I've yet heard addresses damaged nervous system. So really what they're getting is very occupational therapy based. Let's figure out your level of dysfunction, and then we'll figure out how we can help you accommodate your life to manage yourself within this level of dysfunction. And so they've given up on thinking that they can actually even get any better. But then we start working with them directly on the first thing that we ever learn in quantum neurology, which is just waking up the cranial nerves. And they start reading again and breathing again and sleeping again and able to walk with, out of cane and stuff like that. So the average person that I have come see me is referred in by somebody else who knows the power of quantum neurology. And that's the primary thing that I tell the doctors that I want to get into quantum neurology is you won't have to market anymore. Your work will speak so powerfully for itself within your patient database that they will just be sending you their mailman and their neighbor and the person they meet at the grocery store and their mother, because so many people have these issues that there's not really any particular profession that can address that holistically.
Absolutely. And I to the doctors out there, I say the biggest difference between quantum neurology and any other technique out there is the understanding of nerve inhibition and neurological recognition. So those two principles really separate us from other techniques and understanding of how to exercise the nervous system back to health. And we're exercising the microterrain, the fine actions of the nervous system. We're stimulating the natural actions and reactions to achieve a desired result. And once we take the neurology you've already learned in school, and we teach you how to access these things that you truly already know, it's just learning how to apply them properly. And then with strategies, and you go, oh my goodness, I could work with cranial nerves, and I could work with sensory nerves, and I could work with all these other ideas of nervous system congruence and the like, which brings us into your conversation at homecoming. It was a fabulous conversation on using the concepts through nervous system congruence, and why don't you talk about that and how you've seen these ideas unfold in your practice and where these ideas come from for you?
Sure. So my lecture at homecoming was talking about how to work with homeopathic miasms with neurological congruence. Neurological congruence isn't something I made up. That's something that you guys made up. Yeah. And I just learned, right? So the concept of neurological congruence is, again, back to my little pieces of paper, right? So the nervous system communicates to everything. And whatever it is that the nervous system is communicating to, if either the entire nervous system or one nerve of that nervous system is working at some sort of inhibition or less than complete function, whatever it is that it's feeding is going to be at less than complete function. I use the analogy for my patients of a cell phone. I could have the fanciest, brand newest $800 iPhone, and you could have the fanciest, brand newest $800 iPhone, but if we happen to have a bad line, we're not going to have a good communication. And it has nothing to do with our cell phones. It's the communication pattern. So when we're working with the nervous system, we're taking the static out of that entire communication pattern so that we actually have a good connection. So neurological congruence is more this concept. So you've got your nervous system, but how your nervous system is communicating to your energy field and even the field around you, like the biofield. So that's what we're working with when we're talking about nervous system congruence. It's not just how my nerve is communicating to this little pinky, right, to make sure that this pinky works. It's how my nervous system is communicating to my entire organ system and my energy system and the world that I live in around me. So the concept of neurological congruence, from my understanding, was we can find a depletion or an inhibition in that communication regardless of what the effect is. So it could be that I've got digestive issues. It could be that I've got a heart murmur. It could be that my life is just degenerating so much that I don't even feel like I can communicate to my friends and my neighbors anymore. It could be almost anything. And we can bring about a higher level of congruence or connection or communication through that entire field. And if that field is working, what that field is feeding is going to work. And that field is feeding my physical body, and that field is feeding my emotional, mental body, and that field is feeding my spiritual body, and it's feeding even how I communicate to the world around me. It feeds whether or not I come into the office and want to talk to my front desk person, or come into the office and I don't. And then what the conversation is going to be for the rest of the day after that. I honestly believe it feeds the people out there that are going to want to come see me today because I'm having a good day versus not because I'm having a bad day. It's what we're attracting to us. So I started learning about homeopathic medicine, and it was very complicated for me. It was very confusing, but I knew that it worked because I'm an herbalist also, and I'm also a naturopath, and I have experience with homeopathy. So even though I've had experience with homeopathy and I see that it works, I didn't understand how it worked. So I finally set somebody down and I was like, I don't get this. Like, what is the easiest way that you could explain this to me, because I'm not that bright. So explain it to me like you would explain it to like a third grader so I can get it. And they said the primary premise of homeopathy is really, really simple. We have 6 predispositions. So back in the day, in around 400, 500, when homeopathy was originally being talked about by Hippocrates, there was 3 primary dispositions. But then 1,500 years later, when Hahnemann was expanding homeopathy, the world had changed so dramatically that those 3 dispositions, those 3 primary predispositions, had transformed to 6. So we're all born, this is what the homeopathists say, we're all born with one of those 6 predispositions. So it's almost like the concept of a genetic predisposition. We're born with it. Doesn't mean we're going to manifest it. It depends on our environment, our terrain, as it were. So if we could figure out what is the primary predisposition, it's basically the bullet in your gun. Where is, out of your 6-shooter, where is the bullet in your gun that's going to take you down where the other ones might not? And if we can figure out what that bullet is and neutralize it throughout the entire system, and we use neurological congruence, or the concept of neurological congruence, to find what is that predisposition that's going to knock you out before anything else will, and discharge it. And in my experience in my office, when I've been doing that, people will be coming in with stuff that they have fed with a million different things, whether it's chiropractic or body work or nutrition or whatever it is, and it's just not changing. And then all of a sudden we knock out that predisposition and their whole system just falls into place. And then there are other people that, don't have that experience because they haven't degenerated to the point that they're really feeling it, but we knock out that predisposition and all of a sudden they're a much easier person to work with because we've woken up anything in the field that is depleting it. Now, this is what's really cool. We are currently expanding even this because I just had a conversation on the phone with James Sheen yesterday, and he was suggesting that if so much changed since 500 to 1500 that Hahnemann had to add 3 more dispositions, right, into the homeopathic spectrum, don't you think that in between 1500 and 2020, maybe we've had such a dramatic shift in our world environment that we've got more? So that's what we're looking for now.
Well, absolutely. And actually, I haven't told you this, but Dr. Andrew Lineal was talking about that as well, and he wanted to present on that aspect because he had many more things to add to
Awesome.
to that concept. So I hadn't had a chance to talk to you about that.
And that just brings up the final thing that I love about quantum neurology, which I've never experienced anywhere else that I've gone, is you recognize that this technique has the ability to do almost anything, and that none of us doctors are the primary expert on anything. And so what we do is we learn something and we start working with it and we start seeing that it works. And so all of these other doctors start learning it. And then somebody who has a better level of expertise in a certain area can take that information and expand it. So we actually start getting this ever expansive field of knowledge and information that allows us to work with our patients. I've never before worked in any sort of a scientific field that was, and I do consider this probably like one of the most scientific techniques within chiropractic. I've never worked in a scientific field before that was as invitively expansive as quantum neurology is. Like, we all get to play together, and because of that, we're lifting each other up instead of dramatically trying to drag each other down. And because we're able to lift each other up, every single doctor that does quantum neurology gets these types of results and gets these types of patients and has this type of experience. And it's a very awesome profession to be in.
Well, thank you so much for sharing that. And, I've always said that I want everybody to learn to duplicate the techniques that I've developed, and then from there explore the rest of the nervous system, because I feel like I really have a handle on the major actions of the nervous system: the motor rehabilitation, the sensory rehabilitation, cranial nerve rehabilitation. And we've consistently delivered very strong results in those areas. But like you said, I don't have time to, I didn't even know about miasms to the extent that you're talking about. I've heard of them and I understood the concept, but I didn't know about the 6 different miasms. I didn't have the depth of knowledge in that area that you brought to the table, and as well as other doctors like Dr. James Sheen as well. And let me speak on that real quick. Your presentation at Homecoming was based on the principle of nervous system congruence that we're teaching at an event in January. That weekend we're teaching 2 events. We have January 17th and 18th is GMRT, Gonzalez Muscle Reset Technique, where we teach how to reset the length of the muscle in seconds. And the second half of that weekend, January 18th and 19th, is our nervous system congruence event. And that's what we're talking about right now. The only requirement is that you are a doctor licensed to diagnose and physically treat patients. That's the only prerequisite for the course. Please check us out. Also, as a bonus, Dr. James Sheen, the doctor that we're speaking about, will be at the nervous system congruence event, and he's going to be presenting his principles on elements and the application of elements. He's going to be giving a preview on that. So similar as Jen's talking about, he learned the nervous system congruence conversation, and then he started applying it to the periodic chart. And so he's going to be sharing some of his principles from there, which are pretty profound. So I'm very excited about that. So please save the date and register for that. Now, Dr. Jen, you also talked about the GRT light this event. You demonstrated using the GRT light in a different way. And we have seen people do this before, but I really liked how you presented it. Could you just touch on the concept for a second?
Yeah. So let me be clear though. Are you talking about using the GRT light in the field, the biofield?
Yes, I am.
Awesome. So here's the GRT light.
Yes.
And the beauty of the GRT light is it finds, so what George describes, which I think is just profound, I think it's in the very first seminar, because I know that that's what really got me hooked, is that because before I found quantum neurology, I'd been using this chart for years. This is Alex Gray's chart, because I think it's just a beautiful representation of the all that we are. Right? So I don't care whether you're talking about like meditation or anything that you're trying to do to access the all that we are. This is just a beautiful representation of that, because it doesn't just show the physiology, right? Like I am nothing more than my bag of meat, like my muscles and my tendons and how they're telling my organs. Right. I am truly like the all that I am. And that is energetically just as profound as physically. And the all that I am doesn't end at myself, right? It continues out into the world in what we call the biofield. So the biofield is literally this energetic, well, you can see like the biofield as this sheen around the body that is kind of a few inches away. I'm going to say in different techniques that I've learned, it exists somewhere in between a centimeter and maybe up to 9 inches away from the body. But then there's also this matrix of communication that is like this egg shape around the body that is truly the biofield. And there are different, I'm certainly not an expert in the biofield, but there's different people that say it can it exists anywhere from a few feet away from you into like maybe the other room to on a much more subtle level, way out in the distance, which is the way that a mother knows when her child has been hurt and wakes up out of a sleep in order to receive the telephone call, or the way that a twin knows when her twin, who's living in Australia, has had something happen. It's through this interconnection of the biofield, right? So we have this biofield around us. Now we learn through quantum neurology that when we have the light enter our system, we can wake up any sort of a diminished energy within that system. And if I'm working with an energy going into, say, an organ, let's say the heart or the lung, we can put that directly on there. We could actually use this to wake up the energy communication all the way up and down a specific nerve. And it works. It works incredibly well. We want to wake up the brainstem, we just apply it directly to the brainstem. But if we don't have a problem or a diminished energy in something that is directly in our physical body, but is just slightly outside of our physical body, well, how do we wake up that?
Right.
And that's just simply turning the light around. So if I can say I need to wake up my cranial nerve 8 to my eardrum, and there's other things that we're doing at the same time, but the light goes in the direction of what I want to wake up. Mm-hmm. Why can't I just turn that around and have it shoot out into the field? So if you can see the light, let me see if I can get it shooting out into the field, you can see how it's actually going to be affecting the stuff that's behind me in my biofield. I don't want to shoot it into the camera because that'll be obnoxious for the people that are watching, but your biofield exists all around you. So what you do is you use a muscle testing, an applied kinesiology technique, to find out where in the biofield we actually have a diminishment of the communication of energy or light source, and simply wake that up by applying the light into that area of the biofield. So that's kind of what I added into the homeopathic miasms, simply because when you learn about the homeopathic miasms, one of the things that they say is you can get them like down a family line, which I always visualize as like way behind me, connected to my energy field somehow, even though it's not happening present in this room, as well as pick it up from your environment. And what is your environment other than how the world around you is interacting with your biofield?
Right. Well, it was, like I said, we've had doctors present that concept a few times over the years, and I just really didn't get it that well till this weekend. And then working with Lori with her surfing injury, taking the light and pushing it into the body and then pulling it out through the injury area and pushing light through the system, so to say, was very profound. And you, just like drafting in a car, you could feel this spot where the energy field would just like capture that other hand, where you felt like, oh, this is where I need to stay for a while. And it was really profound to feel that and to see that. I don't know if you played with it in that way, but it also just it's feedback from other doctors that I've spoken to since the event. They all are saying how surprised they are at how many findings there are in the biofield not just the physical body.
Yeah.
And very surprising for all of us, and great experience for all of us as well.
Yeah.
And just to mention, for those of you that are interested in the GRT light, there is a sale going on. I don't have the details. Please check out the link in the homepage. But the GRT light is the light therapy device that was developed for quantum neurology, and all the doctors use the GRT light, so we have consistent results from doctor to doctor. So when we say we've done a certain pattern of rehabilitation, we know that using the same light therapy is giving us consistent results from doctor to doctor there. So Jen, I think you have to go, and just in the interest of time, I thank you so much for being here, and also for being the Doctor of the Year. What would you say to doctors that are interested in quantum neurology, and what would you say to them?
I would honestly say that it's the best thing that's ever happened to my life. It's the best thing that's ever happened to the life of my family. It's the best thing that has ever happened to my practice. And I remember the gentleman who got me into quantum neurology had been telling me about it for about 3 years. And then when I finally went to the first seminar, I turned around and punched him and said, "Why did you not get me here sooner? This stuff is amazing." And he was like, "Well, I was kind of trying for the last 3 years." So I would say do it instantaneously. Like, don't, and I know that George and Lori are currently in the middle of expanding and creating a great opportunity to get people understanding exactly what quantum neurology is. So definitely look for that on their website, and just sign up for your first seminar, because when you get to a quantum neurology seminar, if you are a chiropractor who believes in the philosophy and the technique and loves chiropractic, when you get to the seminar, you'll go, "Oh my God, why didn't they ever teach us this in school?" And then you'll instantly be able to run with it. It's one of those techniques that once you get it, which you'll get within half of the first day of the seminar, it will completely change how much you can actually do in the world.
That's right. And thank you so much for sharing that, Jen. And if people want more information, they could visit our website at quantumneurology.com. We also have what you're listening to is the Hologram Podcast, and we'll be posting this on the YouTube channel, the Hologram Podcast. Please check that out. And we also have, I have a new book with Dr. Edward Chauvin, I Am Loving Myself Healthy. It's the #1 in hot new releases on Amazon. Please check that out and support the cause. We thank you for all your support, and we love you, Jen. Thank you so much for being Doctor of the Year. We truly appreciate it, and we'll see you soon.
Okay, bye-bye.
Okay, bye now.